Hi, my name is Hansol. I'm currently an RT student. Today I'll be conducting an assessment to observe how you stand naturally. The purpose to gain a knowledge of how you stand, which will help us to develop a personalized plan. There may be tenderness due to the pressure. If you do feel too much, let me know. I'll adjust it accordingly. And there will be skin to skin and skin to close contacts. And I'll also be examining sensitive areas, including the feet, pelvic region, chest, and your neck. And I'll let you know ahead of time if I do need to palpate that area. Do you have any questions? Do I have your consent? Okay, so I'm going to start with your front view. So I'm going to ask you to make a border on the chest. Thank you. So external, this is the xiphoid process. If I go higher, this is the suprasternal notch, and higher to the facial area, this is the nasal bone. I'm going to start from the bottom. So when you compare two feet, I can see that his right feet is angled out. So because it's angled out, his left feet are straight. However, you can see there's more space in that at the bottom of the foot. And if you go higher, I'm gonna ask you to raise your arms. I'm going to palpate your pelvic region. Is that okay with you? Okay, so I'm going to find the iliac crest. So iliac crest, if I try to compare, seems like this his right iliac crest is higher. And then if I go his shoulder, his left shoulder is higher than the right one. So if I line that up, yeah, so his left is higher. I'm gonna ask you to turn to the side. Turn to the side, thank you. Turn to the side, thank you. And then I'm going to palpate your pelvic region again. So raise your arm for me, thank you. Greater trochanter here, and then acromion here, and then external. Here's the external auditory meatus. Going all the way down to the feet. Feet seems to be okay. However, as you can see, his knees are hyperextended. So how do I know? So if you palpate the muscle, they're a little bit tighter than the normal muscle. And if you could raise your arm for me again. So pelvic, his pelvic is here. Yeah, so his pelvic is the little bit angled towards the front, tilted to the front. So going this way, and then his shoulder is rotated to the front as well. So if I palpate it, you can see there's a curve. I'm going to ask you to take a turn to the other side. Other side here. Thank you. So same thing. Raise your arm for me, and I'm going to palpate your pelvic region again. So greater trochanter here, acromion, and external auditory meatus. Going back, feet seems to be okay. His knees are hyperextended here as well. The muscles are tight. Raise your arm for me. I'm going to palpate your pelvic again. Yeah, so it's slightly tilted to, forward, and then his shoulder is tilted to the front, rounded, curved to the front, towards the front. So here, this way. Lastly, turn to the other side, away from me. Thank you. So if you could raise your arm for me, I'm going to palpate your pelvic region again. So here is iliac crest, going down, PSIS, line up, S2, going all the way up. If you could rotate your neck for me. Okay, C7, and then most prominent bone in the skull, EOP. Going back down, if I see, I can see that his knees are a little bit curved to the outer side. So here there's like a round, the curved. And then if you could raise your arm for me again, I'm going to palpate your pelvic region. His pelvic, yeah. So his pelvic, his right side or left side is higher, so it's more obvious. And then his shoulder, his left one is a little bit broader and is raised a little bit higher. So if I see compare both shoulder, yeah, indeed the left is higher. Good.